The company doctor came when the company decided. The miners' wives showed up every time. Number 16 was the only treatment for the condition killing more miners than explosions. Number 9 was confirmed in 1930, 40 years after miners' wives were already using it. These are 25 coal mining remedies that treated injuries no doctor had a name for. Number 25. Mullein triple strength preparation for black lung. Coal dust pneumoconiosis, black lung, produced a specific type of progressive lung destruction that standard mullein tea preparations could not address at the concentrations used for ordinary respiratory illness. Mining community healers developed a triple-strength mullein preparation, 3 times the plant material, simmered 3 times as long, given 3 times daily. The verbascoside and saponin content delivered at this concentration produced measurable bronchodilation and anti-inflammatory activity in tissue that was progressively scarring from silica and coal dust deposition. Number 24. Solomon's seal root for crush injuries. Crush injuries, the most common serious injury after explosions, produce deep tissue damage that ordinary wound treatment could not reach. The root, prepared as a concentrated poultice applied hot and re-wrapped every 4 hours, was the mining community's treatment for the deep bruising and internal tissue trauma that occurred when a fall of rock caught a man's hand, forearm, or leg without fracturing bone. Allantoin and Solomon's seal stimulates cell regeneration at concentrations the plant delivers naturally. Number 23. Elecampane root for mining cough. Inula helenium, elecampane, was introduced to Appalachian coal communities through the same wave of Eastern European immigration that brought experienced underground miners from the coal fields of Poland, Bohemia, and Slovakia beginning in the 1880s. The root preparation was specific to the mining context, a long-simmered, strong decoction given daily as preventive medicine to men working the dustiest cuts before any symptoms appeared. Number 22. Sulfur spring water for wound infection. The sulfur springs that emerged from the same geological formations that produced the coal were present in every Appalachian coal field. Mining community healers used the water from these springs specifically for wound washing on the cuts and abrasions that underground work produced daily. The sulfuric compounds in the water created a mildly acidic environment hostile to bacterial colonization. Number 21. Lamp black as wound dressing. Lamp black, carbon collected from miners' oil lamp glass after each shift, was used as a wound dressing in some mining communities. The practice sounds alarming until the chemistry is examined. Activated carbon, which lamp black approximates at the particle size produced by incomplete combustion in oil lamps, has confirmed adsorptive properties that bind bacterial toxins and remove them from wound surfaces. Number 20. Lard and pine resin salve for powder burns. Premature detonation produced powder burns covering large areas of skin with embedded carbon and oxidized residue. The mining community, preparation, lard as a fat base, pine resin for antimicrobial activity, sometimes with dried thyme or other aromatic herbs mixed in, treated powder burns through a mechanism that modern burn care would recognize. Moist wound environment through the fat base, antimicrobial coverage through the resin's terpene compounds, physical barrier against contamination. Number 19. Clay poultice for infected cuts. Local kaolin clay from the same geological formations as the coal was applied as a poultice to infected cuts. The electrostatic binding properties of clay minerals adsorb bacterial toxins and draw fluid from infected tissue through osmosis. Kaolin, the specific white clay found throughout Appalachian geology, was the active ingredient in kaopectate from the 1930s through the 2000s. Here is what made coal mining medicine different from every other industrial or frontier medicine covered in this series. The mining company owned the camp, the housing, the store, and the company doctor. The company doctor was paid by the company. His primary function was to return injured miners to work. 18 more. Number 18. American spikenard for respiratory illness. American spikenard was maintained by mining community healers for the respiratory complications of late-stage coal dust exposure, when damaged lungs made every infection more serious. The root preparation, used for centuries in Appalachian botanical medicine as a general respiratory tonic, was applied in the coal mining context as a daily maintenance preparation during winter months when respiratory infection could be fatal to a man whose lungs were already compromised. Number 17. Wild hydrangea root for kidney stones. Hydrangea arborescens, 7 barks, covered in the Ozark episode for kidney complaints, appeared in coal mining communities with a specific occupational context. Miners working in conditions of heat, physical exertion, and inadequate hydration developed kidney stones at elevated rates. The wild hydrangea root preparation was maintained specifically for the mining population. Men who could not stop work to drink water at regular intervals, who sweated heavily and replaced fluid inadequately, and who developed the stone-forming urine concentration that these conditions produced predictably. Number 16. Mullein smoke for black lung, the intervention that kept men working. This is the entry that treated the condition that killed more coal miners than explosions. Pneumoconiosis, black lung, was not formally recognized as an occupational disease in the United States until 1969, when the Federal Coal Mine Health and Safety Act was passed. Before that, for the 100 years during which American coal mining was at its most intensive, the condition that slowly filled miners' lungs with coal and silica dust was not a compensable injury, not a recognized disease, and not the company doctor's concern. Dried mullein leaves burned slowly in an enclosed space, delivering verbascoside and anti-inflammatory volatile compounds directly to the airways. Number 15. Bloodroot for skin conditions. Coal dust embedded in skin abrasions produced a distinctive blue-black tattooing that became infected when the material harbored bacteria. The bloodroot preparation, applied with the precision that Appalachian healers had always understood as essential, debrided the embedded contamination from shallow wounds in a way that simple washing could not accomplish. The compound sanguinarine's direct antimicrobial activity worked on the surface, while the caustic property of careful external application removed the embedded material. Number 14. Gentian root bitter tonic for lost appetite. Chronic nutritional deficiency was an occupational condition of coal mining as much as lung disease. The appetite suppression of extreme fatigue, combined with the physical difficulty of preparing and consuming food in company housing where cooking facilities were minimal, produced a population that was chronically undernourished relative to its physical demands. Gentiana species, the bitter tonics of Appalachian botanical medicine, were given specifically to miners after shifts to stimulate gastric secretion and appetite so that the nutritional intake necessary to sustain the work was actually consumed. The bitter compounds worked through the same mechanism as pharmaceutical digestive aids. Here is the specific number that puts coal mining medicine in historical context. By 1900, an estimated 400,000 men were working in American coal mines. Accident rates in the early 20th century produced approximately 2,000 deaths per year in American coal mines, plus an unknown but certainly larger number of deaths from occupational disease that the absence of diagnosis kept out of mortality statistics. The medicine they maintained was not a supplement to a functioning system. It was the functional medicine in a system designed to be non-functional for the people it was supposed to serve. Number 13. Coltsfoot for the productive cough protocol. Tussilago farfara appeared in the Scandinavian episode for its Nordic preparation. The coal mining application was distinct and more urgent. Black lung produces 2 types of cough as the disease progresses: a dry, unproductive cough in the early stages and a later productive cough when the body is attempting to clear the accumulated material from the airways. The mining community healers distinguished between these stages and treated them with different preparations. For the productive stage, coltsfoot was given to support rather than suppress the cough, to thin the material being expectorated and make the clearance process more effective. The confirmed expectorant properties of marubian and related compounds in coltsfoot made it pharmacologically appropriate for exactly this application. Number 12. Wild cherry bark for the dry cough. Prunus serratina, wild black cherry, provided the coal mining community with the cough suppressant for the opposite stage from the coltsfoot protocol. The dry, unproductive cough of early black lung, the cough that woke men at night, that exhausted them through shifts, that announced to the entire camp that a man's lungs were beginning to fail, required suppression rather than expectorant support. Prunicin in wild cherry bark, converting to benzaldehyde and suppressing the brainstem cough reflex, was the mining community's pharmacological intervention for this specific stage. Number 11. Lobelia for breathing crisis. The coal mining context was more urgent than any previous episode's lobelia application. Acute bronchospasm in a miner with advanced black lung, the sudden tightening of already damaged airways that produced the terrifying sensation of inability to breathe, was the medical emergency that the mining community healers had to address without any pharmaceutical bronchodilators, in housing without telephones, in communities where the company doctor might or might not respond to a summons. A carefully prepared lobelia tincture, administered at the subemetic dose that produced bronchodilation without vomiting, was the only available acute respiratory intervention. Number 10. Witch hazel for bruising and contusions. Hamamelis virginiana, witch hazel, was the universal bruise and contusion treatment in coal mining communities, applied to the daily accumulation of injuries that underground work produced even without serious accidents. The compressed, confined working spaces of a coal seam required constant physical contact with rock surfaces. Minor bruising, contusion, and soft tissue injury were not accidents in the coal mining context, they were the normal daily condition of the work. The tannin and gallic acid content of witch hazel produced rapid astringency that reduced swelling and pain in bruised tissue. Mining wives who kept a bottle of distilled witch hazel in every household were maintaining the primary care treatment for the most common injury category in the most dangerous civilian occupation in the country. Number 9. Comfrey poultice for fractures, the 1930 discovery. The allantoin in comfrey that stimulates cell regeneration in damaged tissue was confirmed by Pittsburgh physician William Thompson in 1930 after a study of traditional Appalachian healing practices that included documentation of comfrey poultice use in mining communities. Thompson's report noted that miners with forearm and wrist fractures treated with comfrey poultice in community settings showed radiographic evidence of accelerated callus formation compared to similar injuries treated with immobilization alone. The miners' wives, who had been applying comfrey poultice to fractures since the 1890s, had been observing accelerated healing in the same injuries that Thompson would later measure. Number 8. Horehound for the shift cough. The persistent cough that miners developed after extended underground work, distinct from the progressive disease of black lung and caused by the acute irritation of coal and rock dust in the airways during a single shift, was treated with horehound candy made by mining community women and distributed to men at the beginning of shifts. The marubian in horehound acts directly on the respiratory mucosa, reducing irritation and suppressing the acute cough response. A preparation given at the start of a shift before the cough developed functioned as a preventive, coating the airway mucosa with a protective film of the plant's active compounds before the dust exposure began. Number 7. Myapple root for the skin conditions of underground work. Podophyllum peltatum, myapple, appeared in the Civil War episode as a cathartic substitute. The skin conditions produced by years of underground work, The persistent fungal infections of feet and hands kept perpetually damp by mine water. The contact dermatitis of chemicals in the coal seam, the slow-healing skin eruptions that nutritional deficiency and poor hygiene produced, were addressed with carefully diluted mayapple root preparations applied externally. Podophyllitoxin, the active compound, has direct cytotoxic activity against the abnormal and infected cell populations that cause persistent skin conditions. Number 6. Pennyroyal for the mining season insects. Hedioma pelagioides, American pennyroyal, the small pungent mint of Appalachian meadows, was used by coal mining community healers for insect control in the company housing that coal operators built cheaply and maintained inadequately. The volatile peulagon compounds that had made pennyroyal an effective mosquito repellent in colonial American medicine made it equally effective for the flies, mosquitoes, and bedbugs that infested the poorly ventilated company housing of the coal camps. Mining wives grew pennyroyal specifically for this purpose, rubbing it on skin and bedding, hanging dried bundles in sleeping areas, and brewing it into a wash for walls and floors during the summer months. Number 5. Goldenrod for kidney complaints. Goldenrod was the kidney tonic of coal mining communities. Miners working in conditions of physical exertion, sweating, and inadequate hydration developed kidney stress that expressed as lower back pain, reduced urinary output, and the kidney stone formation that hard Appalachian water accelerated. The flavonoids in goldenrod have confirmed diuretic and anti-inflammatory properties in the urinary tract. The mining community healers who prescribed goldenrod tea to miners after shifts were addressing a daily occupational health hazard through a plant that grew in unlimited quantity in every abandoned mine entry and stripped hillside in the coal fields. Number 4. White pine bark for the respiratory infections of winter. Pinus strobus, eastern white pine, the bark and inner cambium, preparation for cough and respiratory infection, was maintained in coal mining communities as a winter staple because miners whose lungs were already compromised by coal dust could not afford the respiratory infections that Appalachian winters reliably produced. The prunicin chemistry of white pine bark, the same compound family as wild cherry bark, suppressed the cough reflex while the antimicrobial terpene compounds addressed the secondary bacterial infection that made a chest cold potentially fatal in a man with black lung. Number 3. Witch hazel compress for eye injuries. Rock fragments and explosive residue entering miners' eyes produced injuries minor enough to be ignored and serious enough to cause permanent damage. Mining wives who maintained witch hazel compress specifically for eye injuries were applying the correct preparation to the correct condition. The astringent compounds reduced inflammation, removed surface irritants through the flushing action of the liquid, and provided a mild antiseptic environment that prevented the secondary infection that embedded particles caused. Number 2. The company store medicine chest and what the miners' wives kept instead. The company store in every coal camp sold a standardized medicine chest, patent medicines of varying quality, aspirin, bandaging, and whatever the company chose to stock. The miners' wives who maintained botanical medicine were working with something different in quality and in kind. The company chest treated symptoms. The botanical medicine treated conditions. The company chest was stocked according to what the company store could profitably sell. The botanical medicine was maintained according to what the mining community had observed to work across seasons and generations. The tension between these two systems was not a tension between modern medicine and folk medicine. It was a tension between medicine organized around the health of the patient and medicine organized around the profit of the company that owned the patient's workplace, housing, and store simultaneously. Number 1. The miner's wife, the medical professional, the coal company never paid. The final entry on this list is a role, not a remedy. The miner's wife, who maintained the household medicine, who knew the dose of lobelia for an acute breathing crisis, and the concentration of mullein smoke for a man whose lungs were failing, who had the Comfrey poultice ready before her husband came home with a crushed hand, who distinguished between the cough that needed suppression and the cough that needed support. This woman was the primary care physician of the coal camp. She had no license, she had no wage, she had no institutional recognition. She received no compensation from the company whose product her husband was destroying his lungs to produce. She kept a pharmacological knowledge system alive in conditions specifically designed to make her invisible, and the miners who survived to see their grandchildren largely survived because of what she knew and what she did with it every day. 25 remedies from the darkest corners of American industrial history. The men who built this country's coal economy did it at a cost that the companies they worked for did everything possible not to pay. The women who kept them alive did it at a cost that nobody counted. Subscribe to Forgotten American Ways. The knowledge they carried deserves more than a footnote.